Since you have long years, in a clinical study on the cardiovascular diseases, I have seen that the cholesterol can be cured with the few lifestyle changes, and but doctors still recommend statin, and they recommend them to take it for a very very long time, and they.
Yeah, I know. This is something which we maybe at home we keep talking about it. Statins came in. Statins are one good. I mean, as a medicine, if you look at it, the drug is very potent.
Okay.
It just inhibits the way your cholesterol is synthesized.
Okay.
So there is no cholesterol synthesis happening when you are taking statin.
Okay.
Okay. So they have a good. They immediately bring down your cholesterol level.
Mm-hmm.
But they were initially recommended for people who have a cholesterol level of more than 190 milligram per day. That was the range where they were recommended to take statin, and then bring it down to the normal level, and then you probably were supposed to slowly get rid of the statin. That was the initial approach to statin therapy.
Okay.
And the initial statins were made from fungus. Lovastatin was one of the initial statin which came out, and they were made by some fungal organisms, and they were fermentation based products. Now you have synthetic statins, and then you have hydrophilic statins, and you have lipophilic statins. And so each one of them has a different way it works. Though the basic mechanism is the same, its absorption, its movement, blood crossing the blood-brain barrier, all that is different for different statins. Now the problem has come up because of very long usage of statins. Now, how much can you bring down your cholesterol? Cholesterol is of course required for your body, otherwise you would never make it, right?
Correct. The body makes it.
Body makes it. Why does it make it?
Yes.
It makes it because it's part of your cell membrane.
Correct.
Every membrane has cholesterol. And it is part of your, when you talk about the neurons are protected. Okay, so that protection is from the statin. Okay, from the cholesterol. Now, if you don't have cholesterol at all, then how from where is the body getting cholesterol to protect yourself? See, you cannot bring it down to a level of 40 and 50 where you're not having any cholesterol at all. Okay, so that's what is happening now. And statin related harmful effects are plenty. They are not so widely reported, but there are papers which talk about the toxicity of statin.
Yes.
One thing is statins totally they are very harmful in your absorption of vitamins and micronutrients. Okay, so you take statin, automatically your vitamin D levels, all those levels are going down. Then statins are bad. They are also known to induce type 2 diabetes. So again, see, you're taking statin to bring down your cholesterol level, but you're increasing your diabetes. That is also another connection. Statin and dementia is something which is still a debated topic. Because there were few papers which came about saying statins can cause dementia because they kind of reduce your cholesterol so much, the protective layer for your neuronal cells are lost. So that is what is causing neurodegeneration and dementia, and the rise of dementia is correlated with the statin which came into the market. So that is also, but then there are a lot of papers countering it, saying it doesn't cause anything of that kind. And most of these papers are a little biased because they were not mainly designed to see your dementia. They were mainly designed to see the lowering of cholesterol levels. But then since in the 3 or 4 months that they treated, they didn't find any dementia effect. There are meta-analysis, so many things which are coming up saying there is no effect. But yes, statins do have a lot of side effects if you take it for a longer time. So if you can bring it down by natural means, do that.
I can help.
Yeah, you can help. And if you can't do it, your statin levels, your cholesterol levels are too high, then you can. Statins are very potent drugs. So they can definitely bring down your.
Okay.
But once you reach a stage, don't keep taking them. Probably they can maintain for maintenance also. They can come back to you.
Correct. Yeah. Okay.
I think that's my take on statins.
Okay. And these days we are seeing that quite young people they're having cardiac arrests, and I've personally seen they have healthy lifestyle, they're eating good, they're working out, everything is good in their lifestyle, but still on quite young age.
Yeah, I have seen a 19-year-old getting cardiac arrest. And it's pathetic. You just cannot convince the parents that your son has got a myocardial infarction. They don't believe it because it's generally associated with old age.
Exactly.
Yeah. So, see, from what I have worked on with cardiovascular disease, I can tell you that this particular disease, you can divide it into two major types. One, what is I told you is called stable angina. Stable angina is a condition where you have block in your arteries, but you're not in a stage where your blood flow is totally blocked, and the arteries. See, our body is so flexible that the arteries kind of outmodel themselves. They allow the blood to pass, and as long as you are not doing any strenuous exercise where you require too much of pumping of blood, they are normal. They carry out their normal healthy normal work every day, and they have around 70-80% also blockage, but they're not getting any attack by that time because it's what is known as a stable one. A stable one is such a thick, nice protected one, which is like just growing, but it does not affect you that much. Stable angina can still be managed with different medical help. Now the second type of disease is known as acute disease. This acute disease happens because you just have maybe 20-30% of blockage.
Okay.
But they are known as unstable blocks.
Okay.
This instability is because this thing, whatever is growing, it breaks off.
Okay.
Breaks off into smaller particles, and that smaller particle can flow with your blood and block a narrower artery wherever there is a branching.
Correct.
And that's what causes a sudden heart attack.
Okay.
For people who are very good, having a good healthy lifestyle, it's me basically, and also the younger people whom we are looking at, they all have this kind of acute myocardial infarction, and if you look at their the blockage percentage, it will never be more than 50%, maybe less than 50%. And still it causes a heart attack just because it is moving out because of a rupture of a plaque. So when in my earlier studies, we were so interested in finding out why the plaque ruptures. That's something which is not yet solved, but there are different theories to it. One is probably the stress.
Okay.
Stress again plays a very important role in breaking the plaque, and that can have devastating effects.